Let's see, I think I got cut off right when we were talking about our fifth generation cephalosporin. And again, as we move over, they're going to start to treat more gram negative bacteria. My next group of drugs, down to that one. Carbapentamims on these, they have the broadest antibacterial action of any antibiotics to date. They are bactericidal and they inhibit cell wall synthesis. Because of this, they're often reserved for very complicated body cavity and connective tissue infections in acutely ill hospital patients. They are also effective against many gram-positive organisms. One hazard of these is a drug-induced seizure activity, which occurs in a relatively small amount of patients. However, that risk can be reduced by proper dosage adjustments to those patients. There is a small risk of cross-allergic reaction in patients with penicillin allergies. Imipenem and cilastatin is my drug of choice for this one. It's very resistant to the antibiotic inhibiting action of my former medications, my beta-lactamases. The most There we go. The most severe adverse effect associated with this is seizures, and it's been reported in up to 1.5% of patients who are receiving less than 500 milligrams every 6 hours. In patients receiving high doses, there is more than an increased risk, up to 10% risk for seizures. Seizures are also more likely in our older geriatric clients and renally impaired clients. So we really like to reserve this for when we have infections that aren't being receptive to other antibiotics. Keep moving on. My monobactams. On my monobactams, these are we have one in this class, Zactum. This medication is the only one to be developed thus far. It's useful with gram-negative bacteria, especially E. coli and Klebsiella. On this one, it's bactericidal, excuse me, and we can use it in moderately severe systemic infections and UTIs. It's commonly used in combination with other antibiotics if I have intra-abdominal or gynecological infections. It's only available in injectable form. Keep going down on my macrolides. On my macrolides, we have two in this one. These are bacteriostatic drugs that are effective in a treatment of a wide range of infections. They include various infections of the lower and upper respiratory tract, such as Staphylococcus, Lyme disease, gonorrhea, chlamydia. They are indicated for infections caused by Streptococcus. Let's see. The contraindications for these macrolides are drug allergies, and there's a good table, 38.8, that shows erythromycin formulations can cause some GI-related adverse effects, predominantly nausea and vomiting. Some interactions with these medications is they can compete for hepatic metabolism of macrolides with a couple of different medications. So when they're given with these drugs, the results are enhanced and can cause some potential toxicity of the medication. So we'll have to monitor them closely for that. Macrolides also reduce the efficacy of oral contraceptives. My drug of choice here, I've listed two erythromycins. My first one goes by many product names. It was my most commonly prescribed macrolide antibiotic. It's still available, but because it has some of the GI upset, it's not as widely used. It does better if it's taken on an empty stomach, but because it irritates the stomach so much, most people have to take it with a meal or a snack. And then my next drug in this group of my macrolides is my zithromycin. On this one, it's very similar to my erythromycin, but it doesn't have so many adverse effects, such as less GI irritation. These two are usually used for upper and lower respiratory tract infections. I think I've got one more group here on my tetracyclines. My tetracyclines, they work by inhibiting protein synthesis of susceptible bacteria. They have a wide range of activity. They inhibit the growth of gram-negative and gram-positive organisms. They're used to treat acne. They're also the drug of choice following susceptible organisms such as chlamydia, um, mycoplasma pneumonia, Rocky Mountain spotted fever. They're contraindicated in drug allergies and must be avoided in pregnant women or nursing moms or in kiddos under the age of 8. Some adverse effects that we think about with our tetracyclines. All tetracyclines have similar adverse effects that can cause discoloration of permanent teeth and teeth enamel. They can also cause some hypoplasia in both fetuses and children and possibly slow down fetal skeletal development if taken during pregnancy. Other clinically significant undesirable side effects are photosensitivity, which can cause the individual to have extreme sunburn, can have some GI upset, can cause some vaginal candidiasis, lots of problems with babies, so we want to make sure we're avoiding it with pregnant moms, and can cause some GI upset. Interactions when tetracyclines are taken with antacids, antidiarrheal drugs, dairy products, calcium, enteral feedings, or iron preparations, the oral absorption of the tetracycline is reduced. The tetracyclines can potentiate the effect of oral anticoagulants, which necessitates more frequent monitoring of the anticoagulant effect and possible dosage adjustments. They can also antagonize the effects of bactericidal antibiotics and oral contraceptives. They're known; these medications are known for their ability to chelate or bind with calcium. Therefore, their co-administration with milk, antacids, cause a reduction in the absorption of the tetracycline. In addition, their strong affinity for calcium usually precludes their use on pediatric patients and kids younger than the age of 8, and also it can significantly cause those teeth discoloration. They also pass in the breast milk, so we want to make sure we avoid it with those individuals. My drug here is doxycycline. My doxycycline, it's a synthetic tetracycline antibiotic. It's used to treat infections such as Rocky Mountain spotted fever, chlamydia, and mycoplasmal infections. It can also be used for the treatment and prevention treatment of anthrax and malaria. So when we scroll to the end of the chapter, make sure you're looking at the assessment. Know why we're giving a specific antibiotic, because that's going to tell us what we're evaluating for. Know when we get to the implementation that we're doing excellent teaching on if they've got we're assessing them for anaphylactic reactions for this. We're also noting when they should take the medication, how long they should take the medication, what should they avoid when they're taking those medications, and then evaluation are going to be is the bacterial infection going away. So we should see an improvement in our white blood cells, our temperature should go away, normal vital signs. So if you understand what we're looking for and what they're used to treat, then we understand what we need to evaluate on our evaluation of these patients.